when a woman says, "I'm so afraid. I'm thinking that I might be having Alzheimer's because I can't remember when I walk into a room why I'm there, or I can't remember, like, I'm looking at a friend's face." Like, a lot of people come in and say, "I think I'm losing my mind," or, "Is this early Alzheimer's? I'm so afraid." No, it's not. A lot of folks go through that, and sometimes just by having the right hormone balance or increase, you can alleviate a lot of those symptoms. So, I'm Dr. Kira Kai, and I grew up actually in Vancouver. I was born in China, but we immigrated from China to Canada when I was about 6 or 7 years old, and so yeah, I'm pretty much a Canadian through and through. Yeah. And so my father was actually a medical doctor in China. He was an internist. He was a director of a hospital. Very, very passionate about his work. So that translated with me kind of going with him to work a lot and observing all of the interesting topics and subjects that he used to lecture on with some of his doctors. And my mom, on the other hand, was a herbalist, a Chinese herbalist. So TCM, or traditional Chinese medicine, is very, accepted and common in China. So I grew up with a combination of the two types of approaches. So it always resonated with me that you can integrate, modern medicine, conventional medicine, with the traditions of um, cultural medicine as well. So, um, and really, I always knew since I was a little girl that I was gonna be a doctor. Like, without a doubt, I think from the moment that I can remember, I wanted to be just like my dad. So, as I was going through school in Canada, I kind of, in some ways, needed to discover who I am as a person. So, being Chinese and being a Canadian, I needed to find a common ground, or like basically, see where I fit in. And that path actually led me more to business and strategies and corporate. And so I kind of did that for about 14, 15 years. But medicine always called, like, I was always called to medicine. So um, in about my 15th year with TELUS, I actually had to make the decision, do I quit my career now and go right back to school, or do I continue? And ultimately, it was kind of a now or never decision, and I decided to just quit my career and start all over again. So what made me choose to become a naturopathic doctor was, after really sitting down and thinking about my personal values, and also the different approaches to medicine, and sort of the way that I wanted to practice. I felt that naturopathy was the right path for me. And the reason for that is because there is a just a very natural focus on functional medicine. So what we're looking for is, with naturopathy, is looking for the different root causes of why a person might be having particular symptoms, trying to look at the person holistically as a whole person, trying to sort of navigate the different symptoms, pulling it all together, and treating the person as a whole. So we're not looking to minimize the symptoms, we're looking for root causes of the problem, and then ultimately having a long-term solution. So yeah, the inspiration for medicine itself is actually from my father, because he was so passionate about medicine. He was actually an internist, and he used to be the director of a hospital. So much of his career was also education. He was educating other doctors in different aspects of medicine. So with that example, and also having a mom that was passionate about herbs, She was an herbologist in like a traditional Chinese medicine shop. Having that inspiration from both parents, actually, um, for me, medicine was never something that I was going to miss out on. Like, it was definitely a calling. So, why regenerative medicine is because I do believe in having a holistic approach. I do believe in finding the root causes of a problem, and I want to find solutions that are long-term, addressing the deep lying issues, as opposed to just looking and treating a person in a reductionistic kind of a way, looking at the symptoms as a problem. I believe that we need to dig deeper. I think I came across Remedy accidentally, actually. I think there was a need in my own family because I was looking for functional medicine for my aging parents. I do, I am able to support them more than 80% of the time as in what I do. But I needed to integrate a little bit more with functional medicine from a conventional perspective because I don't have access as much to certain types of testing or imaging or specialists. So I came across Remedy as a need for a family, and I really believe in proactive health, and I believe functional medicine does that. Um, the attraction to Remedy specifically was in sitting down and talking with the leadership team. I found out that philosophically we were in alignment in terms of how they approach medicine, where they're going to bring Remedy into the future. And I thought, you know what, this is very exciting. And maybe just, I was curious out of one day that there might be some opportunity that would come up where, we can work together. So, yeah, I think we're in alignment in vision. Yeah. Yeah, PRP stands for platelet-rich plasma, and basically, PRP falls, in my belief, under the umbrella of a type of injection therapy called prolotherapy. And prolotherapy has been around for like a few decades. And basically, what is prolotherapy? It stands for proliferation therapy. In explaining it in a way where people who are not from a medical background can understand, you could think of it like the objective is when you have an injury somewhere in the body, we're trying to utilize the body's natural way of healing itself. So for example, if you sprain an ankle or hurt yourself, the first thing that the body does is to inflame. And typically when you go and see your doctor, they'll say, let's wait 6 to 8 weeks for that inflammation process, that repair process to self-heal. And then after that, we'll do some rehab, etc. So prolotherapy is trying to reestablish that purposeful inflammation in a targeted and specific area. So it's kind of, think of it like a red flag or a beacon. If you have an injury in the area and the original repair was not sufficient, the body kind of perpetually goes into chronic inflammation and it's not purposeful. And so by doing prolotherapy, you're putting a solution in that area to target that injured joint or even tendons and ligaments. And it's like a red beacon. And it calls your cells to actually migrate and reestablish that repair in order to reestablish what we call tensegrity, tension and integrity. So think of the body like the Alex Fraser Bridge, like your spine, for example. There's lots of tension through those cables, but they're equally distributed. And when we injure ourselves, some of those cables are loose. And so the body, the brain, will want to establish tension by putting in chronic stiffness and muscle tension there. But all of that is not purposeful, and the result is that the person is in pain or tight. And so until you reestablish that tensegrity, you're not going to be able to resolve the problem. So prolotherapy has different solutions. Okay, traditional prolotherapy is just procaine and dextrose, a bit of sugar, to establish an inflammation, to call the cells to migrate and regenerate and fix the issue. PRP therapy is another level. And it basically is the same technique. You're utilizing the person's own cells by taking the cells from the person and then kind of concentrating it into using the type of cells that are most purposeful for the repair. And the reason for that is a lot of joints don't have a lot of circulation, and it's hard for the cells to be sending nutrients and that kind of migration. So when there are like tears that's happening, or after unsuccessful treatment with general prolotherapy, then we would utilize PRP. We would just say, don't call the workers, let's just ship them there. Put them on a bus, ship them to the joint, let them out and let them do the job. So typically, the cells that we leave there will have a couple of life cycles, like every 3 weeks or so, and then we observe the gradual repair of that joint, that ligament, that tissue. Yeah. Oh my goodness. Just about everybody that is walking, talking, living. A lot of athletes do this, both professionals and, weekend warriors, and that's true. But I would say that the majority of my patients are just the everyday folks. We're trying to keep healthy. We're trying to go to the gym. We're trying to play tennis where there's a pickleball rage out there. And so often ligaments, tendons, there are strains, there are sprains, and then there are micro tears. And anybody who has any sort of chronic low back pain, shoulder, rotator injury or tears, or cervical neck pains, like even students or folks who are in front of a computer all day long, folks who have basically chronic pain and problems where it's not completely resolved through physio and chiro and massage, then it's time to add another component to their healing journey. Yeah. Yeah, I am that woman. I'm that woman, and most of my practice are women. The majority of the women that I work with are sort of in their late 30s to early 60s. That's the majority of the folks that I work with. And a lot of women are going through perimenopause and menopause. So luckily, I can learn through my own journey on what it feels like, what experiences that I'm having, what my patients are talking about, I can resonate with. And so in dealing with some of my own symptoms and watching a huge amount of patients go through this, I started to research more and more deeply into what hormone replacement therapy can do. And I believe now, after years of looking at this and working with patients, that hormone therapy is a real benefit to most people, women and men, actually. And if we were talking about women, we can think of hormone therapy as a alleviation of certain unwanted perimenopausal symptoms, or we can think of it as being a little bit more proactive in terms of wanting to optimize healthy aging. And let me explain the difference. Like a lot of women who go through perimenopause and menopause will have symptoms of like brain fog, fatigue, hot flashes, irregular periods. They'll have joint pains. Those are all sort of some of the common symptoms that we see. Inability to sleep is a big one as well. So if we were to use hormones to balance that out, we understand that perhaps sleep is more aggravated when a person is losing progesterone. Hot flushes come when a person's losing more estrogen. Not always the case, but often that is the case. And we can use a combination of testing as well as understanding the person's story and their symptoms to come up with a game plan to alleviate some of these symptoms. And when we're able to balance the hormones in such a way, most of those symptoms can be alleviated. And a person can be in perimenopause or transition into menopause or be in menopause in a much gentler and appealing way, and we all have busy lives. We all have careers or are very much involved with our families and our children. We would rather be able to support them emotionally, energetically, going through, those stages without having to worry about, what all of the things that are involved with hormonal issues, right? So that's one aspect of it. On the other hand, I like the idea of being proactive in health. Hormone therapy is amazing for that. More and more research are kind of showcasing how safe and effective it is in terms of like helping women, especially with cognitive decline, with preventing cardiovascular decline, and with losing bone mass, and so bone density. And so if most of the research says that the most benefit for a woman to prevent any of those would be to start hormone replacement therapy as early as possible, even in perimenopause, and definitely within 10 years of menopause. And that's the majority of the research that we see. Doesn't mean that 10 years post-menopause that it wouldn't do anything for you. It just means that the research has been focused on, just within menopause. And so when we have women consistently more supported in the estrogen area, then we notice that they are able to keep the cognitive function a lot higher. They're able to have their blood pressure and cholesterol and blood sugar maintained at a more consistent level, and a bone density. They're able to maintain the bone density better in relation or in along with resistance training, and of course eating well and sleeping well. I think they're similar, right? All of it is talking about optimizing the body's own ability to either heal thyself or to support healthy aging. And so I think that medicine is going into that direction, or should be going into that direction, right? The days of being more looking at symptomatic control without looking for long-term benefit and solution, I think that's not doing justice for what medicine can do for people today. And so, yeah, my interest in that is to be able to bring about healthy aging, healthy living, maintaining good mindset and mood and cognitive abilities as folks age. Yeah. Well, great question. And I love that because I love the fact that you're focusing on tailoring individual need. I think medicine, it's really important to understand that each individual is different. Their genetic makeup is, might be slightly different or influenced by, generations of genetic variations. And also phenotypically, how we're influenced by the way that we grew up, by our environment, by our lifestyle choices, differentiates people from people. And so how do I help them and tailor a treatment for them would be to, first of all, listen to their story, listen to their symptoms, to their past history, and then combine that with, laboratory testing, imaging, anything that we feel is required in our assessment, then coming up between, the results of the evaluation, quantitative evaluation, with the subjective expression of symptoms, then we come up with a game plan. And medicine is, in some ways, trial and error too, right? You can think that you're sure that you're on the right path, but sometimes you have to be able to tweak and calibrate the plan in order to come up with just the right thing for the patient. Yeah. Oh my goodness. I do hormones quite often, so stories come up all the time. So only recently I had um I'll call her a young lady. You can call her a young lady, but she's in perimenopause in her sort of mid 40s and came in and just like even before speaking with her, I could sense how drained she is. Like she's exhausted. And quite emotional. And so her biggest concern was that she had 3 kids and they're all sort of in teen or preteen. And she just had no motivation to support her family and work full time. And so, in some ways, I just kind of sensed the emotional, almost desperation for help because she's tried, different things. And to be honest with you, she didn't feel like until that point she was able to really connect and have somebody truly listen to her. So the first meeting was a little bit emotional for her. So in that meeting, I listened and we decided that we needed to do uh, some testing, and also recognizing where she was in her hormonal journey. I kind of said, the testing may not be as accurate because you're at a stage where things are kind of fluctuating quite wildly. So we'll take that as a guideline, but I'm really using your expression of your subjective point of view of how you're feeling and your symptoms, and we're going to weigh that heavily. And after getting the information from her and the lab together, we started some hormone therapy. And I truly, truly expected and warned her that we need to calibrate and probably have to have a few meetings before we get this on track. Well, um, a couple months, like I think I saw her 6 weeks later after we started. Generally, I try to see a person a month or 6 weeks after just to make sure we're on the right track. And of course, have them, you know, call me if they needed extra support. But anyway, she walked in and she gave me a hug. She was a completely different person. She's like, I just looked at her, her skin was glowing, her energy was different, and she's like, oh my gosh, thank you so much, Dr. Kira. I feel so much better. I have so much more energy. I'm more engaged with my kids. I want to be at their practices. I'm able to meal plan instead of trying to order in a lot because I'm just so tired. You know, yeah, they're in a better mood. I'm in a better mood. Yeah, I'm sleeping better. Thank you so much. And so now we're just with this particular example, we're just on a maintenance. Not every situation I get that is, that quote easy, but majority of people can get there in time. Misconceptions about regenerative or functional medicine. I think that there's a lack of understanding actually of what it is. It isn't about over testing. It isn't about, the cowboy, approach about medicine, trying all these new things that are on the market and pushing, maybe um, i- the new frontier. Like, it's not necessarily that. Functional medicine is just what it says. It's like looking at a person and kind of trying to understand the intimate, um, collaborative functions within the body, whether it's biochemical, hormonal, right? Or physiological, like your musculoskeletal or neurological. And the body isn't made of parts. It's not a sum of parts. It works together. And so different aspects of all of those influence each other. And what we're trying to do is we're trying to understand the different pieces of the puzzle and how they come together and kind of link up, right? Think of a computer. If you have the background programming, something is not working, it spins. The computer's working, it's just not optimally working. So in some ways, we're trying to see clean things, or we're trying to you know, uh, optimize different functions and processing so that the whole system works well together. Um, and it could be as simple as minor tweaks of nutrition, or it could be as complex as trying to detoxify and to balance out hormones and to, you know, making sure that the nutrient levels are up all at the same time. So it's very individualized. Yeah. Yeah. You know what? One of the things I love the first meeting because you really get to connect to the patient and listen to why they're there. You want to really understand what their goals are, and you want to really understand what will make a difference in their daily lives. Okay. And I always tell them in my engagement is that I'm a facilitator. I will walk the path with them, but I'm not going to be fixing them. They have to be empowered themselves in order to take action and responsibility in the journey together. And so, with that understanding, there are going to be coaches and changes in lifestyle, in nutrition, in, how compliant we are with certain treatment plans. And by kind of identifying their role and responsibility and my role and responsibility in facilitating that, the journey is done together. And when they accomplish or start to feel better, they have a really strong sense that they're participating, truly participating and taking control of their health. And when they get to the good, they feel that they can continue on their own and then just kind of touch base with me once in a while, right? And that feels good. So instead of feeling like you need somebody else to pick you up all the time, you feel like you know what you need to do when we go off track, right? And then you know that you can have long-term success instead of just short-term, symptoms control. Oh, goodness, I'm so much more empathetic. Like, I could literally say, I get that. Oh, I know what you mean. Or, oh, I feel that too. Yeah, so understanding what my patients are talking about and sort of experiencing myself, because I know myself and I know I'm fairly sensitive. So I'm not an easy fix. So I know that when I run into difficulties in balancing my own hormones, I know that not every patient is going to follow what you might learn in a course and how it should go. So having the patience and also having the conviction and the confidence that it does get better allows me to become a more patient and more focused practitioner to be able to help my patients get to where they are going, and also them knowing that I'm going through the journey and or have had similar experiences gives my patient the confidence that we'll also get there eventually. Yeah. Hormones are so critical. I don't think we've emphasized hormones until recent years. I mean, it's blown up now, right? Like if you look at a lot of specialists, OBGYN, a lot of doctors, they're actually seeking more knowledge. They're going to do their own courses and experiencing and becoming, certified with hormone replacement therapy, working with hundreds, if not thousands of patients, going through journeys, and then ultimately wanting to spread the message. And that's why it's so prevalent in social media or on YouTube. You can learn a lot. And a lot of my patients actually come to me well educated. In fact, more educated than probably their general doctors are. And it's the more we learn and the more research we do on hormones, the more we understand that the more that we understand the different symptoms that a person is feeling in transitions in life are actually hormone related. So for a long time, we didn't realize that some women losing hormones can experience a lot of pain, a lot of joint pain. It almost resembles rheumatoid arthritis or even sensory like nerve pain and feeling really stiff. And in some cases, they've been told, well, sorry, but that's part of growing old, with an acceptance of like that's what one should live with. I'm one of those people. I could not believe the the intense change in pain. And I'm a pretty active person, but until we balance out the hormones within the body, that pain can actually be alleviated. Yeah. Another example is when a woman says, I'm so afraid. I'm thinking that I might be having Alzheimer's because I can't remember when I walk into a room why I'm there, or I can't remember, like I'm looking at a friend's face, acquaintance, and I know them well, but the name doesn't show up. Or, my kids are saying, "How come I just told you this like yesterday? How come you don't remember it at all?" Like a lot of people come in and say, "I think I'm losing my mind," or "Is this early Alzheimer's? I'm so afraid." No, it's not. A lot of folks go through that, and sometimes just by having the right hormone balance or increase, you can alleviate a lot of those symptoms. I think functional medicine should, in my opinion, be the approach of all medicine. You know, I mean, if we were to look at traditional medicine, really, they were looking to balance the entire body, even in a language that today we might not totally understand. But really, if I studied different areas in the world, different places with their traditional medicine, they're always looking for um, leveraging the body's natural ability to heal thyself. And that's functional medicine, right? To kind of identify the areas that are imbalanced, and by bringing it up to homeostasis, by achieving homeostasis, you're able to allow, to utilize, to trust in some ways the body's ability to heal itself. That's functional medicine. And that approach should be all medicine, I think, for long-term resolution, right? Regenerative medicine, I think, is just one aspect, but with an added bonus of technology in some ways, right? Body's ability to regenerate has been there. We have cellular function. An easy example is if you cut yourself, there is a process where it regenerates. You get a scab. Oh, well, first you coagulate, you stop bleeding, and then it forms a scab, and then over a period of time, your cells are laying down new surface to heal the cut. Yeah, so it's the same thing that happens inside, and so I think regenerative therapy is a nice fancy way of saying we know that happens in the body. Now, what can we do with technology, science, and medicine to kind of actually support that? That's what regenerative therapy is. So I think it's brilliant. I think going into that direction is the right move for medicine. First step is give us a call, set up an appointment. The first step is getting to know each other. The first step is for me to listen to the person's story and understand where they're coming from. And then through that discussion, we can establish what the next steps are. And generally, it's seeking to fill the holes of knowledge. Like, what pieces are we missing that we cannot establish or be confident with just an interview? We probably need to do some additional testing or imaging. And once we have a satisfactory amount of information, that gives us a foundation to leap off of to start the actual treatment. And from that, it's, trying trying to calibrate. And it's no different than building a house or, anything else. You're always kind of working with the patient to sort of calibrate what needs to be done to get to the optimal level. Yeah. Oh, wow. My go-to advice is, the number one thing is put yourself as a priority. You know, Everybody, our friends, our families, our work, they're all priorities, but women tend to be multitaskers, and women tend to be the center of a family or in a relationship where they're like looking after different aspects of everyone else's life as well. And we actually, we're the last to take care of ourselves. And if we don't take care of ourselves, then we can't take care of others as well, right? And so aspects of taking care of ourselves is time to breathe, time to sort of work on mental health, to be good within our own hearts, right? That's one. Sleep. We actually, a lot of the times will neglect sleep in order to try to finish the amount of tasks that never seems to actually finish. So sleep is so important because it's such a huge impact on energy, on hormones, overall well-being. Nutrition. We will bend over backwards to find the right things for our kids to make sure that they have the strength to go play sports, to make sure that they're eating organic and great food. And then in the end, we're the ones that are like sort of, grabbing whatever is available just to fill our bellies, right? And so those, like, on a practical sense, those are like some of the things that are so I don't, some people might think of them as minor or just surface level, but they're not. They account for at least 50% of our well-being. And so the other things are like sort of the cherry on top, like how we work through the biochemistry and all that is great, but we cannot forget the practical things. And so my go-to is make sure you take care of yourself, make sure you have sleep, make sure you have good nutrition, make sure your adrenals are well supported, because for a middle age or menopausal woman, the adrenals do a lot of work, and even for young folks as well. So, and we can go into the adrenals a lot more in the future, but anyway, so that's what I would suggest. Yeah. Oh, lab results is the last thing one should measure success from. Many people have lab results that are perfectly fine, but they don't feel very good. So lab results are tools. And so how do I measure success is in what has changed in terms of daily impact in their well-being, their everyday lives, how they feel energetically, emotionally, um, that's how I measure it. Yeah. Like if a person has a complete shift in terms of the way they feel, the way that they're able to navigate through their daily lives, and they're telling me, they're doing well, then then I'm happy. And we're going to continue to support that for sure. Yeah. And anytime, we always have up and downs. Life is up and downs. Your health is going to be always up and down. We're always going to be there to support. Yeah. That's how I measure success. Like, one of the things that I wanted to kind of mention as a naturopathic doctor is that there's a misconception that we're all about just herbs and nutrition and everything has to be natural. That's not the case. What we're aiming for is is honing in or utilizing the body's natural ability to try to heal itself as much as possible. But we do recognize that there are times that we need medicine, especially in acute situations or situations where they're not going to fully recover. We realize that. So we have the education and the certification to be able to do, to have to be able to prescribe prescription medicines when needed, to be able to kind of really understand, that sometimes we need unnatural things as well. So yeah, it's about having a big enough toolkit to be able to find the right tools for that specific individual's needs.